In Good Health, brought to you by McLaren Northern Michigan.
Recent study shows that about 23% of people aged 18 to 65 actually have some form of bunion deformity, and that increases to over 30% after age 65, so they're relatively common. I'm Christopher Kennedy. I'm a foot and ankle surgeon with McLaren Northern Michigan Orthopedics. Bunions are, in the medical term, we call it hallux valgus. It is usually just a bump at the base of your first toe, at the bottom of your big toe. Right here at this joint, we call it the first metatarsal phalangeal joint. You know, left untreated, a bunion is not going to kill you. It is, however, probably going to impact your daily life. We use our feet 10,000 times a day. We do that day after day, and without having that innate ability to walk, we notice it. Pain is the biggest thing. Some people do experience some forms of instability and have even reported falls from bunions. You know, even though I'm a surgeon, I like to treat my patients conservatively, at least at first, unless it's an absolute acute emergency in which needs surgical intervention, but a bunion rarely is that. Conservative options for treating bunions include things like over-the-counter pain medicines or anti-inflammatories, some bracing of your shoe, inserts in your shoe that can correct abnormal mechanics of how you walk. There are a number of different surgical interventions that we can do. There's an arthrodesis procedure where we fuse the joint of the big toe. There's an arthrodesis procedure where we fuse the metatarsal joint, and that's further back in the foot. And there we're just trying to attack the central rotation of the deformity and correct it right at its spot. Other surgeries include minimally invasive osteotomies, where we break and then straighten the metatarsal bone, which sometimes is deformed. Even further, we can actually replace the big toe joint in the case of excessive arthritis. The recovery time is really dependent on what type of procedure we did and what kind of bunion you have and what the goals are to return you to your activity. A lot of bunion procedures, however, can be weight-bearing the next day in protective shoe gear.
To schedule an appointment or see an orthopedic specialist, go to mclaren.org/northern or call 800-248-6777.